Good morning, everyone, and welcome to this session on careers in the NHS and in healthcare. My name is Abby. I'm from the NHS Health Careers team, and I am joined today by Jess as well. Jess will be telling you more about what she does in a bit. So to begin with, I'm just going to go through a few slides, hopefully not too many because I don't want to bore you. And then Jess and I will be having a chat, and then we're going to take your questions. So there is a Q&A function, hopefully you can see. So please do put some questions in because we'd really love to be able to get those answers to you straight away today. What I'm hoping to do in the next kind of few minutes is just make you aware of the massive range of roles in the NHS. People often know about doctors, nurses, physiotherapists, paramedics, midwives, but don't necessarily know about all the other roles. And there are actually over 350 different roles in the NHS, with loads of different routes in as well. So we're going to be talking about some of those and showing you some places to go so you can find out more information afterwards as well. So hopefully you'll be inspired, hopefully you'll be informed as well, and you'll know where to go if you want to find out more. So thank you so much for joining us, and really hope that it's a useful session. So there are some myths, I think, about some of the careers in the NHS. Some people think that you've got to have a degree to work in the NHS. You don't have to. There are loads of roles where you don't need a degree. Some people think that you've got to be able to deal with blood and stuff like that and be able, all the jobs are to do with patients, but not all the jobs are directly involving patients. Some are much more behind the scenes. So if you're more into tech and computers, then there are roles for you in the NHS. If you don't like blood, there are roles for you in the NHS. So if you'd rather be more behind the scenes, that's absolutely fine. Not everyone wants to work with patients. So one really important thing to mention is that although the NHS kind of there's an overarching umbrella kind of organisation, each NHS trust, so that's a hospital or a group of hospitals, each kind of GP surgery, that kind of thing, is an employing organisation in its own right. So some NHS trusts have got loads of apprenticeship offers, others haven't got so many. So it really can vary. Some NHS trusts call a job a certain job title, another one might call it something slightly different. So it's just being aware of the differences there. Okay, so I know there's a lot of information on this slide, and this is just to try and categorize the roles that we have in the NHS. It's not a perfect categorization because there's no such thing really, but just to quickly run through allied health professionals. So that's roles like, well, it's the sector that Jess is in, and so we'll hear more about that in a bit. So that's roles like speech and language therapists, radiographers, podiatrists, prosthetists and orthotists, and many others. The ambulance service team, so not just paramedics but also call handlers as well, and emergency care assistants and other roles. The dental team, again, not just dentists, but you've got dental nurses, hygienists, therapists and technicians. Doctors, we've all heard of them, but did you know there are over 60 different specialties within medicine? Estates and facilities, so these are roles where people are making sure that the buildings the NHS care is delivered from are safe. So we've got mechanics, we've got electricians and plumbers and project managers as well. And health informatics. So if you're really into kind of digital data and technology, then there are so many roles for you in the NHS, and that's an area that's just expanding all the time. Healthcare science, some roles where they're very patient facing if you want that, but other roles where you're much more laboratory based if that's the kind of thing that you want. And management, the NHS is a huge organisation, and we need managers of people, managers of money, managers of buildings, and we need kind of strategic managers as well. So again, lots of options there with all sorts of schemes to fast track people into management roles. The medical associate professions, the main one I'm going to mention here is one called physician associate that's becoming much more common in the NHS now. Midwifery as well, so we've all heard of midwives, but did you know there are maternity support workers as well that work alongside midwives and do a really important role? And nursing, again, all heard of nurses. There are 4 different types: adult nurses, children nurses, learning disability nurses and mental health nurses. and they are a real focus. The NHS published something called the long-term workforce plan a few months ago, and we know that we need a lot more, particularly adult nurses, mental health nurses, learning disability nurses. Pharmacy, so this isn't just pharmacists, but you've got pharmacy assistants, pharmacy technicians as well, where you don't need a degree. And the psychological professions really expanding here, lots of different roles, some where you need a psychology degree, some where you need doctorate level training, so that's even after getting a degree, but other roles where it might be that you've got lived experience of mental health challenges, and that's all you need to get into roles, so a real range there. And public health. So I think we all learned a bit more about public health during the pandemic, a little bit more about what that's about, kind of protecting our society, keeping us well, preventing spread of illness, that kind of thing. And the wider healthcare team, which just encompasses so many other types of roles. So if you're into communications specialists or chaplaincy within hospitals, again, loads of different roles in there, so do have a look, and I'll show you some resources towards the end. I haven't got a lot of time, I'm really aware. We want to get on to chatting to Jess and to answering your questions, but just a few ideas here. If you're a very practical hands-on person, just some of the roles that you might be interested in doing. As I say, we haven't got much time, so I'm not going to stop on this slide, but I think you'll be able to watch this back afterwards if you wanted to kind of spend more time looking at it. Or maybe you'd like to work with young people and children, and lots and lots of options here. You know, it's not just about being a paediatric nurse or a paediatrician, but there are lots of other ways that you can work with young people. Or maybe you're really into science and you want to use that in a way that makes a difference to people's lives. That's the really vital thing about NHS roles. Whatever you're doing, you're making a difference to people at the end of the day. So loads of options if you're into science. And you can get in at so many different entry points. So it might be that you get some work experience or do some volunteering. There are roles where you can enter with GCSEs. There are roles where you might need a degree. So if you want to be a nurse, if you want to be a doctor, you do still need a degree, but there are different ways of getting that. And we're going to be talking more about apprenticeships with Jess in a minute. But lots of different entry points for the NHS. Just a few of the recent apprenticeship vacancies, just so that you can have a look at those quickly. So I've just tried to pick out a little bit of a selection in a variety of places around the country, just to give you an idea of the range. You know, did you know you can be an apprentice chef in the NHS, for example, or a sustainability and waste officer or manager? So the increasing number of kind of green environmental roles as well in the NHS now. Did you know you can become a radiographer by doing a degree level apprenticeship, or be a mechanical craftsperson doing an apprenticeship in the NHS? All of these you'll find on the NHS jobs website, by the way. That's where you'll find jobs and apprenticeships advertised. And there are plenty of degree level apprenticeships as well. And again, we'll be hearing more about that from Jess very soon. And I'm sorry, this is such a quick whiz through these slides, but just wanted to give you a little bit of an overview so that you've kind of been, you know, as well informed as possible before we chat to Jess and answer your questions as well. And then there are lots of degrees you can do full-time at university too. And there is some financial support for some of these, which is always really important to find out about. So there is something called the NHS Learning Support Fund. So if you're doing a nursing degree or a midwifery degree, or many of the allied health professions, so for example, physio, radiography, that kind of thing, you can get something called, the NHS Learning Support Fund, which gives you at least £5,000 a year to help towards your living costs. And it's not a loan, so it doesn't have to be repaid. So it's really, a great thing to be getting some cash and not having to repay it. So there are some subjects you get more than £5,000 for. If you want to find out more about that, then you can have a look at the NHS Business Services Authority website, because they're the people who administer this fund. But I just thought it's important that you know about that. And just very quickly, some example apprenticeship pathways. So maybe university isn't for you. Maybe you realise that you learn in a slightly different way. Maybe you want to start earning money sooner. So apprenticeship routes can be used to progress a career. So you could start off, say you want to be a healthcare scientist, you could start off as a healthcare science assistant at level 2. That's equivalent to GCSEs. You could move on to a healthcare science associate apprenticeship at level 4, and then on to a degree level healthcare science practitioner apprenticeship. So that's at level 6. And we haven't really got time to talk through other options here, but into nursing as well, there are various apprenticeship routes that you can do by progressing through a series of apprenticeships, gaining experience the whole time and earning money. Okay, very quickly, I'm going to talk about work experience. I know that can be a really, really hot topic within health. It can be difficult to get work experience. It was difficult before the pandemic. It's perhaps even more tricky now. We know we haven't got enough work experience opportunities in the NHS. So, but don't give up. Okay, so knock on doors. Ask the question, even if you can get a day, even if you can get a morning or an afternoon shadowing, take whatever you can. Look online. There are some online work-related learning opportunities as well. Think about volunteering. Think about other things you do that evidence you're the right sort of person for a role in health. So maybe you work in a shop, you're delivering customer service, you're using communication skills, you're using teamwork. Think about those transferable skills, okay? So it's about thinking really, really broadly. Because what we're looking for in the NHS are people with these values. These are the values from the NHS Constitution. So do you know what compassion means? Do you know what compassion looks like? How would you recognise compassion in other people? How do you demonstrate compassion? What about respect and dignity? How do you evidence that you understand what that means and how you would behave in a respectful way towards patients if that was a role you were doing? So think really carefully about these values. If you're applying for a course, applying for a job, think about how you can evidence that you understand and live these values. That is just as important as you having the right qualifications for a role. So think about those. Health Careers websites. This is healthcareers.nhs.uk. This is where you'll find tons of information about careers in the NHS. So do have a look at that, because we've got a careers quiz on there. You can have a go at that, answer a series of statements, and it will bring up some suggested roles that fit your skills and your interests. This is what the quiz will look like. So it'll bring up those roles, and then you can click into those to find out more about them. We've got a course finder tool. So if you are wanting to find a course, for example, you want to become a therapeutic radiographer, you can use our course finder tool to find the universities that offer that course. Click through then to the university, and that'll tell you the all-important entry requirements. It's so important to check the entry requirements of different universities because they can really, really vary. And this is the NHS jobs website. This is what it looks like. This is where you'll find apprenticeship vacancies and job vacancies in the NHS. So you can search in lots of different ways, but I just wanted to show you what that looked like. They've got hints on applications and interviews as well. So there's tons of information out there. I've talked a lot. That's enough. We're going to hear from Jess now. So I am just going to stop sharing my screen, and we will get on to chatting. And as I said, please remember that we've got the Q&A function. So if you want to get your questions in for either for myself or for Jess, then please do that. Okay, Jess, thank you for your patience there while I rattled through rather a lot of information, probably a little bit too much for 10 minutes. Thank you so much for joining us today. Jess, to start off with, can you just kind of tell us who you are and what you're up to?
Yeah, hello. Well, my name's Jess. I'm 24 years old, and I'm currently a physiotherapy assistant / apprentice at Great Ormond Street, so the hospital for children in London. And I work part-time, well, full-time as an assistant in the hospital. So I'm doing my normal role. And then one day a week, I'm at university, so learning all about physio and all that it covers. And then few hours a week, I also have study leave. So whenever I need to catch up on lectures, I need to do self-directed learning.
It sounds pretty busy.
Yeah.
Brilliant. Well, thank you for taking the time to join us today. So Jess, can you just tell us kind of since GCSEs, what's your career journey been like? How has that kind of panned out?
Yeah, so straight from GCSEs, I went to college and I did something called health studies. So it's almost like health and social care, but a bit more sciencey. And it was a BTEC. And then it came around to deciding whether I wanted to just go out and work or go to university or what I wanted to do. But I knew I wanted to go into the NHS, and I just literally thought it was all about doctors and nursing. And, coming from an Asian background, people are like, oh, well, my dad was like, you need to be a doctor. But that didn't suit who I was and my personality. And then I found the role of physiotherapy. So I decided to look and explore more into that. And then I applied through UCAS. And then I interviewed at St. George's University in London. And I got into the course. I did 2 years of normal undergrad, so normal uni life. And then I found I was quite lonely. I didn't feel greatly supported, and I was struggling to learn at uni. So then I decided to look for jobs in the NHS role.
Mm.
So I found my job now, which is the physiotherapy assistant role. Came around to 2 years, and I thought that I should go back to uni, but then I dreaded going back to uni. And that was a time when apprenticeships started to come into hospitals, and it was really hot in promoting them. So then I found the one that was linked to University of London, well, University of East London, interviewed for that, and now I'm doing that, and now I'm on my third year.
Brilliant. So it's not been like the most straightforward route, but you're getting to where you want to go to. And I think that's such an important message for people listening, because sometimes you think you've got to have everything planned out and it's all going to go really smoothly, and it doesn't always, life doesn't always work like that, does it? And that was a brave choice actually, to recognize that full-time uni wasn't for you. But brilliant to hear that you've kind of found the path now that
Yeah.
you're on. So my next question was going to be why you picked an apprenticeship, but I think you've probably answered that. I mean, is there anything else you wanted to add to that?
Yeah. So because I'm working in the hospital actually pays for my apprenticeship. So no uni fees. So I'll have nothing to pay back when I finish. And then I get my full-time wage, which is at band 3 and 4, which is assistant banding system that we have in the NHS scheme. Band 5 is when you graduate, but I'll be earning as a band 3 and 4. So yeah, I mean that's great from a financial perspective. So if you want to go out and earn money and not think about, do I have to pay for a degree and pay that back? That's a great option. But also at work, I have a cheat sheet. I always have people to ask. So if I get stuck on a question, or if I feel like I need to go see this like in person, what I've just learned about, I can go to that team and learn about it. So I literally have a cheat sheet, and I always will be learning on the job, regardless if it's relevant to what I've just learned. We have something called fast track learning. So what you learn in lesson, if it's applicable, you can put that straight into practice. And then you can always, refer to your manager or your team to see if you're doing the right things or if it's safe. So you're always supported.
Brilliant. That sounds great. And so in terms of the kind of the balance between work-based learning and classroom learning, can you tell us a bit more about that? How does that split down?
So like I said, per module at uni, we have 3 hours protected learning time. So you can either go shadow another team, or you can do some self-directed learning at home. So going over lectures and then kind of doing your own study that way. At work, you do your own, well, your work-based job. So not really relevant to uni, but you are learning skills that you wouldn't particularly get to learn in uni. So patient facing stuff, so learning to communicate with parents or the children or the patient, learning to coordinate treatments, learning to actually do the treatment that's relevant to your team. So you're always learning, and it is sometimes hard to balance because you have a full day of work, and then you sometimes have to go home and do more uni, but you always feel so much more supported because you have a team at work that you can always go back to.
Right. Okay. And it sounds like it's just so perfect being able to put things into practice straight
Yeah.
away
Yeah.
and make sense of that academic learning. Yeah.
Mm.
Brilliant. Do you have exams as part of your degree apprenticeship?
Yeah, so like a normal undergrad degree, I still have my exams to pass each module. Sometimes it might be an essay, But when it's exams, it's normally like practical exams. So they give you a case study, case scenario of like a patient, and then you have to do the treatment. And then if it's essays, it's normally to do with like learning about evidence and finding evidence.
Okay, great. So a mixture of things.
Yeah.
And you've talked a bit about the support that you get in the workplace. And so what about the support from the university, the kind of the degree side of things as well? How does that work?
Yeah, so at uni, we also have an appointed tutor, as you would do even as an undergrad. But also, people are a lot more understanding because you are working a full-time job. So that if you're struggling, they'll definitely offer advice to you on how you can manage that. But also, they will liaise with your manager to say if it's like a particular difficult time or a difficult module or something's not working out. So
Yeah,
there's always
yeah,
linking in and there's always communication.
brilliant. Okay. Um, and what do you enjoy about it?
My role or the uni part?
Well, let's talk about the role so that, you know, what is it about being learning to be a physio that is, yeah, and about the actual day to day when your job, when you're working with patients.
hmm So I work with pediatrics, so children. So yes, I'm treating the child, but also I'm looking after the families that are involved in the children. So we run a rehab class full of sometimes maximum of 20 kids that are all doing exercises together. And I love leading it and I love building relationships with the children and like seeing them get better day in, day out, and then actually seeing how the parent changes their attitude towards us. Sometimes it is very difficult as a parent to see your child going through, this difficult time and being kind of
Mm.
feeling helpless. And then they kind of take it out on you, but that's where that compassion comes in, communication comes in, and education comes in, and then the parent kind of changes their view towards you, and it's a nice feeling that you can make that real difference.
Yeah. Yeah,
Yeah.
you're so right that if you are, as you say, if you're working with children, it's not just about the child, it is about their support network as well, isn't it? Who else do you work with? What other kind of NHS staff members do you
Mm.
work with in everyday life, Jess?
Yeah. So I work with occupational therapists. I work with speech and language therapists, the doctors, the nursing team. We will also have something called a play specialist or play therapist at Gosh. So play specialist, you don't have to have a degree for. It's like a diploma, I believe, and you get to help children through the situation through play. Play therapy is slightly different. That kind of involves a bit more like psychology. I also work with, the oh gosh, I forgot. I work with all the other assistants and the other teams. I work with sometimes the radiographers, people that even take the blood, the administration team. So there's so many people that I work with, even though I'm
Yeah.
just doing physio, because you have to liaise so much for this one patient.
Yeah, yeah, one big team effort, isn't it? For yeah,
Yeah, definitely. So yeah, whatever you're
brilliant.
doing in the NHS, you're definitely helping.
Fab, thank you. And the other question I was going to ask you is about paying for your apprenticeship, but you've already answered that. So if you could just kind of tell everyone what you're going to end up with, what qualification you'll end up with at the end of your apprenticeship.
Yep. So I'll be receiving a undergrad BSc physiotherapy degree at level 6 because it's a degree leveled apprenticeship. So I'll be able to go straight into a band 5 job, which is a qualified person in that role.
Yeah, brilliant. And you won't have had to paid for it. So yeah, it's
Yeah, definitely.
so these, the degree level apprenticeships are so good because you end up with exactly the same qualification, don't you, as if you'd gone full time to university. So yeah, what's not to like?
Yeah.
Right, was there anything else? Oh yeah, just one more question, Jess, before we see if there hopefully there are some questions from people watching. It would be good if there are. So in terms of the future, so obviously the focus at the minute is getting your physiotherapy qualification and getting started in that. Have you got thoughts about where you might want to go with that in the future, or is it too early to say?
I still want to work with children. I think actually the team that I'm with now is kind of, I don't know, made for me in a weird way. Like I love being kind of I can't I love being with children, and I love like being a child myself, just being able to like play sometimes, have a bit of fun, mess around whilst trying to get them to do the exercises. And like my caseload, so my caseload is rheumatology and pain management, so kids that have arthritis and lupus, which is a serious disease, but it's not as life threatening as some of the other diseases. So it's difficult enough, but not too difficult where it can be kind of sad at times. So I really enjoy that balance of it being difficult and having to use your brain, but not too much where it's like they're at an intensive care unit.
Sure.
But I
Yeah.
also love doing this part where like promoting apprenticeships, talking to young people and trying to like promote them to just consider apprenticeships, because yeah, undergrad uni can be hard, it can be lonely, but if it's made for you, it's made for you, and if it's not,
Yeah.
there's other options. So I love promoting that thing as well.
Brilliant. Thank you, Jess. I think that is such an important message, is that, yeah, we can talk about going to university, we can talk about apprenticeships. These are different routes, and that's great because there means options for different styles and different people. Brilliant. Thank you so much, Jess. Gonna have a look at the Q&A. So we have got a question. Well, we've got a question about would we be able to come to schools to deliver this presentation. So thank you for asking, but unfortunately we're a really small team for the whole of England, but we do lots of social media live events. So if you follow the NHS Health Careers team on social media, you'll see loads of live events, and then you can watch those either live or on catch up. Okay, Laura, thank you. Do you have to, so this is a question for you, Jess, do you have to stay with the same hospital after your apprenticeship? That's a good question.
So my particular hospital, no, I don't have to stay at the end. It's a choice. Some hospitals might ask you to stay for like a year or so to like, I don't know, almost like paying back. You know, you've been trained up there, they've paid for your university, and they might just ask you to stay for a year. But most hospitals can actually just say you can leave if you want to and go experience other hospitals, and which is great for your development and learning to go experience other hospitals. So they never would keep you for long,
Yeah.
or if they do keep you.
Yeah, brilliant. Thank you. Well, that seems to be all the questions, which yeah, is surprising. But we do have, if you're watching this on catch up, or you think of some questions in a few days' time, we do have a Health Careers contact centre. So if you go onto Health Careers website, so that was healthcareers.nhs.uk, and go to contact us, we do have a contact form you can use there, and you can get in touch with us for answers to questions. So hope that's been helpful. Thank you for listening, Jess. Thank you so much for joining us today. And yeah, we hope we've given you some food for thought and some places to go to look for more information. But thank you so much, and hope you enjoy the rest of the event. And actually, sorry, the other thing I should say is we do have an NHS Careers booth at this event today, and I'll be able to answer your questions there if you type them in. So you can head over there, and I will be answering questions if you think of anything after now. But otherwise, thank you very much.